Hello, my name is Gersy, and for my presentation, I will talk about Chapter 3, which discusses the American hospital from 1945 to the present. The American hospital system has changed dramatically since 1945, evolving into a complex network of healthcare facilities that serve diverse populations. After World War II, hospitals expanded rapidly to meet the growing demand for medical services. This period marked the rise of government intervention, insurance programs, and advancements in medical terminology. Legislative changes, such as the Hill-Burton Act, played a crucial role in shaping the modern hospital system. Over time, hospitals transitioned from local community-based facilities to large, specialized medical centers. Innovation to medical research, digital health records, and telemedicine have further transformed patient care. Understanding this historical progression helps us analyze how hospitals operate today and anticipate future challenges. As we explore the evolution of hospitals, we will discuss key policy shifts, hospital classifications, economic trends, and groundbreaking innovation that continue to reshape the healthcare landscape. After World War II, the U.S. experienced an unprecedented demand for hospital services. The war has exposed gaps in the healthcare system, and as soldiers returned home, there was an urgent need for expanded medical care, better facilities, and more healthcare professionals. One of the most significant shifts during this time was the rise of employer-sponsored health insurance. Programs like Blue Cross and Blue Shields became more popular, making hospital care more accessible to the general public. This increase in insured patients led to a higher demand for hospital beds, medical staff, and advanced treatments. The federal government also began playing a larger role in healthcare funding, leading to an increase in hospital construction across the country. However, despite this growth, rural areas still struggle with limited healthcare access, creating a gap that would take decades to address. After World War II, the United States faced a severe hospital shortage, which became a national concern. The war had drained resources, leaving many hospitals understaffed, underfunded, and unable to meet the growing demand for healthcare services. As a result, the country was officially recognized as under-hospitalized, meaning that there were not enough hospitals or medical facilities to care for the increasing population. To address this crisis, the federal government stepped in with funding and policy changes to expand hospital access. Urban hospitals began to expand their facilities and medical services, but many rural areas still lack hospitals, doctors, and essential healthcare services. This healthcare disparity disproportionately affected low-income populations, communities of color, and veterans, who struggled to receive proper medical care. Despite these challenges, the post-war period set the stage for major advancements in medical care, technology, and hospital infrastructure. The demand for more healthcare professionals led to an increase in medical schools enrollments, ensuring a steady supply of doctors and nurses. One of the most important policies to address this post-war hospital shortage was the Hill-Burton Act of 1946, officially known as the Hospital Survey and Construction Act. This act provided federal funding for hospital construction, particularly in underserved and rural areas, with the goal of expanding healthcare access nationwide. The law required hospitals receiving federal funds to offer a percentage of free or reduced cost care to low-income patients. This was a groundbreaking step in promoting healthcare equity, ensuring that more Americans, especially those in economically disadvantaged communities, could receive hospital care regardless of their ability to pay. As a result of the Hill-Burton Act, thousands of hospitals were built or expanded, particularly in rural areas where access to health care had been limited. However, while the Act successfully increased hospital capacity, it did not fully resolve racial and socioeconomic disparities in healthcare access. Many hospitals remained segregated, and, and access to high-quality care is still varied based on location and income. Despite its limitations, the Hill-Burton Act set the foundation for future healthcare policies, including Medicare and Medicaid, which would further expand hospital access in the 1960s. By the mid-20th century, hospitals have evolved into central pillars of medical education, research, and advanced care delivery. No longer just places for patients' treatment, hospitals became hubs for training healthcare professionals and conducting groundbreaking medical research. The partnership between hospitals and medical schools became particularly significant, allowing for hands-on education for future doctors and nurses. During this time, specialized hospitals began to emerge. Facilities dedicated to cardiology, oncology, pediatrics, and other disciplines became essential in delivering focused high-quality care. These hospitals addressed the growing need for specialized treatments as medical knowledge expanded. Technological advancements also play a significant role in the transformation of hospitals. Innovations like imaging technologies, surgical techniques, and laboratory diagnostics enabled hospitals to offer more sophisticated treatments, improving patient outcomes. As a result, hospitals gained a reputation for being places of cutting-edge care and life-saving interventions. Hospitals also began to shifting toward community-based care, expanding outpatient services to address broader population's needs. This shift allowed hospitals to provide preventive care and manage chronic diseases outside traditional inpatient settings, making healthcare more accessible. Hospitals in the United States can be classified based on their roles, services, findings, and affiliations. This classification highlights the diversity in how hospitals serve their communities and fulfill healthcare needs. General acute care hospitals are the most common type, providing emergency care, surgeries, and general medical services. These hospitals cater to a broad range of patient needs and are vital for handling acute conditions and injuries. Specialty hospitals focus on specific medical areas such as orthopedics, cardiology, oncology, or pediatrics. These facilities often provide advanced treatments and expertise in their respective fields. Teaching hospitals are affiliated with medical schools and play a dual role in providing patient care while training future healthcare professionals. They are often at the forefront of clinical research and innovation, offering specialized and experimental treatments. Hospitals are also distinguished by their ownership and founding models. Non-profit hospitals prioritize community services and reinvest profits into improving care, while for-profit hospitals focus on generating revenue for shareholders. Lastly, government-owned hospitals, such as those run by the Department of Veterans Affairs, primarily serve military personnel, veterans, and their families. General acute care hospitals have undergone significant changes in recent decades, adapting to shifts in healthcare delivery, patient needs, and technological advancements. One major trend in the shift from inpatient to outpatient care, hospitals now focus on providing same-day procedures and ambulatory services which help reduce costs and improve efficiency. This shift is driven by advancements in minimally invasive procedures and improved recovery times. Hospitals, mergers, and acquisitions have also become increasingly common. By consolidating researchers, hospitals can improve financial stability, extend services, and expand access to specialized care. These large networks often include urgent care centers, outpatient clinics, and specialty facilities, creating integrated healthcare systems. Another key trend is the integration of electronic health records, which enhance communications, improve documentation accuracy, and allow for better patient management. Hospitals are also leveraging telemedicine to reach patients in remote areas, providing virtual consultation and follow-up care. Additionally, there is a growing emphasis on cost efficiency, with hospitals working to reduce the advantage length of hospital stays and minimize unnecessary readmissions. These trends reflect the evolving role of hospitals in delivering value-based patient-centered care. The 1980s marked the beginning of a new era in hospital medicine, shaped by rising healthcare costs, government policy changes, and advancements in technology. One of the most significant advancements was the implementation of cost-contained strategies aimed at controlling expenses while maintaining quality care. Hospitals began adopting more efficient care models, focusing on reducing the average length of stays and emphasizing outpatient services. The introduction of Medicare and Medicaid reimbursement reform further transformed hospital operations. Payment systems transitioned from fee-for-service to prospective payment systems, incentivizing hospitals to operate more efficiently and improve patient outcomes. This shift also encouraged hospitals to focus on preventive care and the management of chronic diseases, reducing hospitalizations. Technological advancements during this time, such as the adoption of electronic health records and automation, revolutionized how patients' information was stored, assessed, and managed. These tools improved care coordination and reduced administrative errors. Hospitals also began to enhance ambulatory and home-based care models, allowing patients to receive care outside of traditional hospital settings. More recently, the expansion of telemedicine and other digital health tools have enhanced hospitals to extend care beyond physical locations. The healthcare landscape has undergone permanent changes due to advances in policy, technology, and hospital operations. The introduction of Medicare and Medicaid fundamentally reshaped how hospitals are funded, providing access to health care for millions of older adults and low-income individuals. These programs created a reliable revenue stream for hospitals, but also imposed new regulations challenges, requiring hospitals to balance cost efficiency with quality care. Technological innovation have had an even greater impact, transforming how care is delivered. Advanced diagnostic tools such as MRI and CT scans have improved the accuracy of diagnosis. Similarly, robotic surgery and other minimally invasive technologies have enhanced outcomes and reduced recovery time. The COVID-19 pandemic accelerated the adoption of telemedicine, making virtual care a mainstream option. Telemedicine enables hospitals to serve patients in rural and underserved areas, offering convenient and accessible healthcare. Alongside this, the expansion of alt-driven diagnosis have allowed hospitals to provide faster, more personalized care to patients. These changes have fundamentally altered how hospitals operate, creating a more technology-driven, patient-focused system. As we move forward, hospitals will need to continue adapting to meet the changing needs of society. Modern hospitals face a variety of challenges as they navigate the complexities of today's healthcare environment. One of the biggest issues is financial instability, driven by declining reimbursement from Medicare, Medicaid, and private insurance, raising operational costs, including those related to staffing, technology, and infrastructure, put additional strain on hospitals, especially at smaller facilities and rural hospitals. Another significant challenge is the shortage of healthcare professionals. including nurses, primary care physicians, and specialists. Staffing shortage not only increases workload for existing staff but also compromises patient care quality and safety. This issue is further exacerbated by burnout, especially in the wake of the COVID-19 pandemic. Hospitals also struggle to comply with increasing regulations requirements related to patients' privacy, safety standards, and quality benchmarks. These regulations, while essential, add administrative burdens and increase costs. Additionally, healthcare disparities persist, with rural hospitals and underserved communities facing limited access to resources and specialized care. Bridging the gap between urban and rural healthcare remains a critical issue. To overcome these challenges, hospitals must embrace innovative solutions, such as out-driven staffing tools, partnerships, and advanced care models. The future of American hospitals lies in innovation, technology, and preventive care. Hospitals are increasingly adopting AI and robotics to enhance efficiency and improve patient outcomes. For example, AI-powered tools can analyze medical data quickly, assessing in diagnosing and predicting patient needs, while robotic systems are being used in surgeries to improve precision and reduce recovery times. Another major shift in the focus of personalized medicine, where treatments are tailored to a patient's unique genetic profile. This approach is expected to revolutionize care, especially for conditions like cancer and rare diseases. Wearable technology is also transforming healthcare by enabling remote patient monitoring. Devices such as smart watches and fitness trackers allow hospitals to monitor patients' vital signs and health data in real time, reducing the need for frequent hospital visits. Hospitals are also expanding community-based and preventive care services, aiming to reduce hospital admissions by addressing health issues early. By prioritizing wellness and chronic disease management, hospitals can lower costs and improve popular population health. As healthcare the, evolves, the focus will remain on proactive and patient-centered care, ensuring equitable, accessible to advanced treatments and fostering a stronger hospital communities connections. Hospitals in the United States have undergone tremendous transformation since 1945, from addressing critical shortage in the post-war era to becoming innovative hubs for advanced medicine and research. Hospitals have evolved to meet the changing needs of society. Key legislative actions, such as the Hill-Burton Act, laid the foundations for increased access to health care, while Medicare and Medicaid redefined hospitals' funding and patient care models. These policies ensured that millions of Americans could receive medical care through this, even though disparities remains a challenge. Technological advances, including AI, robotic surgery, and telemedicine, have revolutionized how hospitals operate and deliver care. The shift toward personalized medicine, outpatient services, and preventive care reflects the industry's ongoing adaptation to modern demands. However, hospitals face ongoing challenges, including financial pressure, a staffing shortage, and regulatory complexities. Addressing these issues will require innovation, strategic planning, and collaboration between hospitals, policymakers, and communities. Looking ahead, hospitals must continue embracing technology and proactive care models to enhance efficiency and equity. The ultimate goal is to create a healthcare system that prioritizes accessibility, quality, and patient-centered care, ensuring a healthcare future for all Americans. Thank you for joining this exploration of the evolution of the American hospitals.